Hello and welcome. My name is Dr. Raj Persaud and I'm a consultant psychiatrist based in London. And I'm delighted to be joined today by Professor Charles Raison. Charles is the Mary Sue and Mike Shannon Chair for Healthy Minds, Children and Families. And he's at the Human Development and Family Studies School of Human Ecology at the University of Wisconsin-Madison. And this is in Madison, Wisconsin in the United States. And Charles is the lead author of a group of people who've published a very interesting paper in one of the most prestigious journals in psychiatry, JAMA Psychiatry, previously known as the Archives of General Psychiatry. And the title of the paper is Whole Body Hypothermia for the Treatment of Major Depressive Disorder, a Randomized Clinical Trial. And this paper has attracted a lot of attention. But first of all, Charles, let me start by asking you, what is whole body hypothermia, and how come you got interested in the subject in the first place?
Okay, well, thanks, Raj. Whole body hyperthermia is sort of what it sounds like. It means that you heat up the whole body, so you're not heating up just a part of the body, although with the machine we use, and most machines, the head actually sticks out, so you're heating up the body, more or less from the neck down. Whole body hyperthermia has been used for years for various things, and you can control the temperature so that, we used what's called mild whole body hypertemperature, which is that we treated people up to a core body temperature of 38.5, and then we stopped. Much higher temperatures have been used in patients with cancer. When you use much higher temperatures, you're really talking about a different procedure. So we might say, just to even further clarify, that we used mild intensity whole body hyperthermia. Now, I originally got interested in this because, in fact, there are a lot of data that have been collected over the years suggesting that people with major depression have thermoregulatory abnormalities, that there's something about how the body regulates body temperature and how it regulates mood that are related. And in fact, if you made a list of the core chemicals in the brain, things like serotonin and norepinephrine that are very relevant for mood regulation, and you lined up that list with the list of chemicals that was relevant for body temperature generation and control, you'd see that the list was completely 100% overlapping. And so I and my colleagues have for years have been interested in the idea that major depression may be a disorder characterized by an abnormality in thermoregulation. We know that people with major depression literally run their body temperature a degree or two centigrade higher than folks that are not depressed. Some studies suggest that when you treat their depression, their body temperature goes back to normal. So we had some evidence that if you heated the skin, it might activate nervous pathways that run up to certain brain areas. And by doing this, not only normalize body temperature, but also activate brain areas that we know are abnormal in major depression. So basically, the idea behind this was that, as with other sensory modalities, thermal stimulation might be able to serve as a deep brain stimulator, as a way to tap into evolved pathways that have very specific signaling effects in the brain, and to use those pathways to change how the brain is firing, and by doing so, to relieve depression.
So when we're referring to hypothermia, we're basically referring to warming the body up, but you're very careful to be quite precise by what we mean about warming the body up. And the precision seems to be about the exact temperature achieved, and maybe something a bit about how it's achieved and how long it's achieved for.
Yes, we don't know, I think, the answer to the question of whether it would make a difference if you achieved it rapidly or slowly. We know that with the device we used, most people took about 60 to 90 minutes to get up to a body temperature of 38.5. Now, the reason done.
Oh, I'm still
Hey,
here,
Roger.
Charles. I lost you
Hey,
there
I'm
for a minute.
sorry. You know what? It's my goddamn laptop. I just realized that if I don't occasionally move the arrow button, we just bought it and it goes into sleeper mode. So
Okay, all right. Okay.
my bad. Can we
Sorry,
back up a little bit?
you were talking a little bit about how it's achieved and the temperature.
Okay, so we'll start that again.
Yeah, sure.
So we don't know, Raj, we don't know whether it would make a difference, whether people were heated up more or less slowly or rapidly. We do think that 38.5 was a good temperature for this first study because it's at the upper range of mild hyperthermia. You go higher than that and you start running into an increased risk of side effects. And there's also data in animals and humans suggesting that if you raise the pain up to the level where it's really painful or uncomfortable, you activate very different brain areas than when the pain is within when the heat is within the range of pleasant. So we think that what we've done with selecting this temperature of 38.5 is maximally stimulate thermal pathways that register pleasant heat signals from the environment. Now, we haven't tested that. We don't know yet whether you might get more of a bang for your buck if you pushed up the heat a little bit or lowered it a little bit. So this is really at the very beginning of this work. And so we cannot at this point say conclusively that we chose the perfect temperature, but we clearly chose a temperature that had a big effect.
So before we get on to discussing the actual study itself, many people would think that this is a bit like what saunas achieve, that your research is kind of backing up the idea that saunas might be a cure for depression.
I think that's right, actually. I mean, you know, the box we use is this $50,000 very high-tech infrared heating device. It's got lots of bells and whistles, so it looks impressive. But we don't think that there's anything magical about the device or the infrared heat per se. We're pretty sure that it really just has to do with, if you will, stressing the body's thermoregulatory system by, you know, heating people up. Now, most people do not spend 60 to 90 minutes in an uninterrupted way in a sauna or a steam room, and we definitely do not recommend people doing that. For one thing, the temperatures are very different. It's a lot harder to control. You know, in this study, we were monitoring core body temperature, heart rate. So we were doing a lot of safety precautions. But I will tell you that we don't think there's anything magical about the box. Now, you know, I stuck myself in the hyperthermia machine, and I'm an aficionado of saunas and steam rooms, and I had never been that hot in my life. When I was in that hyperthermia machine, I mean, I was huffing and puffing, and sweat was pouring off my body. So I know that the thermal load delivered in our study was greater than the thermal load that at least people like me would experience in a sauna. But it may be much more similar to the thermal load that people get in sweat lodges. And it's interesting, you know, around at least the United States, there's been this sort of movement. There are a couple of these urban sweat lodges where people go in and they actually use similar infrared heating technologies. We don't know. We haven't studied them. We don't know how hot they get people. But yes, we think that in general, if a steam room, if a sauna makes you feel better, we think we've now provided evidence that you are on the right track. And we increasingly think that there's real physiologic reasons why, if you do feel better after a sauna or a steam room, we think it's because the heat is changing your brain function in ways that make you feel better.
But why is it then, theoretically, going to a warm country should maybe be achieving the same thing?
Right.
Epidemiologically, we should find epidemiological evidence that there's lower rates of depression in warm countries. Right.
So, in fact, we know that's not really true. We don't think that it's warmth per se, or as you say, you know, Arizona would be the happiest place on the planet. We think that what it is the phasic stimulation of the heat. So the first thing, though, is, you know, the box gets up to about 130 degrees Fahrenheit. I don't know what that is Celsius, but it's hotter than anything but the highest temperatures ever recorded on Earth. So and the box isn't, you're getting much more heat than that in your body. I mean, I can assure you that you cannot get that hot out in the sunshine. I don't even think if you died of heat stroke, you could get as hot as that box makes you feel, you know. So the first thing is that there's an intensity difference. The second is that, in fact, you know, we think that what's going on is that we're sort of shocking the system with this jolt of heat. And we think that what's going on, at least to some degree, is that that jolt of heat is sort of resetting the body's thermostat. Imagine that depressed people in general, their thermostat is sort of stuck, and it's stuck on too hot, which is why their body temperature is elevated. We think that the hyperthermia device is a little bit like taking a hammer to the thermostat, giving it a ding, and causing it to unstick, and then it resets at a lower temperature. The reason I say that is because in our first much smaller study that we actually did in Switzerland, there was no control group. It was a much simpler study, but we managed to get core body temperature before and 5 days after the treatment. And we found that the hyperthermia, acutely, it heats people up. But if you look at their body temperature 5 days later, their body temperatures dropped significantly. And the more their body temperatures dropped, the more undepressed they were 5 days later. So that's consistent with this notion that, in fact, in a weird way, the box is actually cooling people off. By stressing the system, it's resetting the system at a lower temperature. And the more it does that, the more undepressed people get. At least that's what our data would suggest.
I also thought, and I could be wrong here, that the thermoregulation idea may explain why sleep problems are such a commonly associated symptom of depression, because there's something to do with temperature changes that occurs at night when we go to sleep, which helps us sleep. And depressed people often have a lot of trouble with sleep. And I thought there was a possible link with your thermoregulatory story there.
Yes, quite right. I think there certainly is. I mean, we don't know for sure, but you're right. We know that that if you look at the elevations in body temperature of depressed folks, that the elevations are largest at night. And we know that slow wave sleep, sort of deep restorative sleep, requires a drop in body temperature. And there are studies showing that, people with depression do better if you have them sleep in a cooler room. If you don't let people shed heat, you're not able to initiate deep sleep, and deep sleep is disrupted in depression. And so, right, we suspect that these things are linked together, and then they become this sort of vicious circle. And when you don't sleep well and your body temperature's up, you also can get elevations in kind of chronic mild elevations in inflammation, which are also widely seen in depression and may be relevant for how this treatment benefits people.
Okay, so let's talk about the study itself. Tell us what you did.
Well, okay, we got ourselves one of these fancy machines, a Heckel HT 3000 specifically, and we decided, based on an open study we had done in Switzerland. So a first study, we treated 16 depressed people, just gave them a treatment and saw what happened. And we saw this reduction in body temperature that correlated with this really nice 45% reduction in depressive symptoms. The problem, of course, with that first treatment was that there was no placebo. There was no control condition. And we know that, many factors go into a depression treatment: hope, expectation, and then the fancier the treatment, the bigger of an effect it's going to have on people's psychology, right? So, you get in a box, you get all this heat, you lay there, it's a big deal. It's going to make you feel like we're doing something for you. So we had to figure out a sham condition. The question we wanted to know was, first, can we repeat the finding that treating people one time with hyperthermia causes longer-term reductions in depression? That was one question. The second question was, can we figure out whether that reduction is specific to the heat or whether it's just more of a placebo response? And so we hit upon a kind of nifty placebo procedure. We, for the placebo or the fake treatment, the sham treatment, we put people in the box. And you're laying in the box and you can't really see the lights that are applying infrared heat. So we built around those real lights, fake lights, just regular lights that we painted orange so they look the same color as the infrared lights. When the machine runs, a fan turns on, so we put a fake fan in the back of the machine in hiding. And the machine allows you to generate a little bit of heat with these coils that are at the bottom of the box or the tent. And so we turned on the coils, so that in fact people in the sham condition began to get warm, and their body temperature did go up a little bit. So it wasn't totally a placebo with no effect, but their body temperature didn't go up very much. But in the sham condition, so people lay there, they saw the lights, they heard the sounds, they felt a little bit of heat. None of them had ever gotten hyperthermia, so they didn't know what to compare it to. And because of that, after the treatment, we asked everybody, do you think you got the real treatment or the fake treatment? And 71% of the people that got the fake treatment thought they got the real treatment. And only not, 95% of the people who got the real treatment thought they got the real treatment, but there was a person or two that actually, we gave them the full heat, man, it's, hot, and they still thought maybe we'd given them the fake treatment, as a sort of a pessimistic view of the world. But the point being that the fake treatment worked very well. Most people believed it. And so people came in, we took people with major depression. They had to have a severity score that is similar to what they use in antidepressant trials. They had to be depressed for a while. They could not be on antidepressants because we have some evidence that antidepressants may interfere with the biologic effects of the hyperthermia. So depressed people, not on antidepressants, most of them have been depressed for years. We blindly flipped a coin. Half of them got the real hyperthermia. Half of them got the sham or placebo treatment where they laid in the box with the mild heat. And we assessed their depression before the treatment and then at 1, 2, 4, and 6 weeks after the treatment. So that was the design of the study. And we used depression scales that are the ones commonly used, again, in antidepressant studies.
And what was your finding?
Well, our finding was that as with the initial OPENS trial in Switzerland, active real hyperthermia produced a very rapid antidepressant response. So we actually had people report on their positive and negative mood immediately after they got out of the machine. And people in both conditions said they felt less depressed, less sad, but only people that got the active hyperthermia had this big increase in how happy they were. They felt inspired, energized, happy, which is something we've noticed anecdotally, that the box has an acute mood elevating effect. But then we began to see an immediate drop in depressive scores at 1, 2, 3, and 7 days following the active treatment, but not the sham treatment. And by day 3, by self-report, which was a secondary measure, the hyperthermia was already beating the sham and had reduced depression scores in the group as a whole by about 45%. So if you got on the sham treatment, on average, you got maybe, 5 to 10% better. If you got into the active treatment, you got about 45 to 50% better. Almost all of that improvement occurred in the first week or two. Now, what we expected going into the study was that the effect would be short-lived and that, within a few weeks, the effect of the hyperthermia would wear off and people would go back to being depressed again. We did not see that. In fact, all the way out to 6 weeks post-treatment, we saw a very significant, large advantage for the active hyperthermia. So people that got the active treatment were still much less depressed on average than the people that got the fake treatment, even 6 weeks later. This was a surprise to us. We don't know if it's a true finding or whether it's a quirk of the study, because the placebo people also did somewhat better out to 6 weeks. But it's interesting that the effect did not fade. As a group, people had this long-term response to a single treatment. Now, this doesn't mean that everybody in the depression group got somewhat better. It means that about 2/3 of the people in the depression group got a lot better, and about 1/3 didn't have a response. And that's kind of what you see with antidepressants and ketamine. Everything that people look at seems to have that equation. So there were several people that got the active treatment that went into full remission, and that remission persisted for months afterwards. We didn't see any of that in the control condition, but again, it's not a miracle cure for everybody. And the fact that on average, it only reduced depressive scores by 45% means that one treatment of hyperthermia works not quite as well as 6 weeks of an antidepressant. Usually you'd see 55, 60% reduction on average with an antidepressant. So anyway, that's what we found.
So a lot of people have felt you've generated a very big effect size, and that's caused some comment. Any reaction to that?
Oh, yes. And I've been trying to say this every chance I can. So, the effect size is just the size, the difference in this case between how much of an improvement the placebo sham group got versus how much of an improvement the active hyperthermia group got. And we found a huge effect size. It's 3-4 times larger than you see with an antidepressant. And people have misread that, I think, to think that we're suggesting that hyperthermia is some sort of miracle cure. And I can assure you it most definitely is not. As we said, an overall 45% improvement is significant, but it's no miracle cure. You know, ketamine gets a much, much bigger response, for instance, than hyperthermia. But what it does say, the reason that the effect size was so large is because the placebo, getting a single fake treatment of hyperthermia, did not have much of an antidepressant effect. It didn't do much of anything at all. The reason the effect size is so large is because we had a medium improvement it compared to, say, antidepressants. But unlike antidepressants, which have a big placebo effect, the single exposure to the placebo hyperthermia didn't do much. So, what I think the study says is, again, not that this is a miracle cure, but that there is now pretty good evidence that the effect of hyperthermia on depression does not seem to be accounted for primarily by placebo factors. Instead, it appears that there is something active about high levels of heat, that something about an acute exposure to high levels of heat has an independent antidepressant effect that's not accounted for by laying in the box and thinking you're getting a treatment. And so I think that's a very important point to make here, is that, right, that large effect size really has a lot to do with the fact that the placebo did not work very well, and that in turn suggests that there is a true antidepressant effect of hyperthermia.
So you've already speculated a bit about what this mechanism might be by which heat is producing this change. Could you say a bit more about that and what your theories are?
Yeah. So we have two theories, and I have no idea how they line up with each other. So you have to take these with a semi-grain of salt. But we know from animal data that if you put an animal in a hyperthermia chamber, in this case a rat, and you give it a treatment of hyperthermia, it produces an antidepressant effect. We haven't published these data yet. But it also activates very specific areas in the serotonin region of the brain, down in the midbrain, an area called the dorsal raphe nuclei. It's like a deep brain stimulator. Heat does not turn on all the serotonin areas. It only turns on these very specific subnuclei. And we know that those nuclei have big connections with parts of the brain that are abnormally functional in depression. So we think that there is if you will, a nervous or nerve-based signal that heat, especially on the skin, has these very specific brain effects. That's one mechanism. The other mechanism, it has to do with the immune system. So we haven't published this yet, but we, of course, I'm kind of an immune system scientist. We looked at what does hyperthermia do to inflammatory markers before, after the treatment, and then at 1 week after the treatment and 4 weeks after the treatment. And, interestingly, we assumed that hyperthermia would reduce inflammation because, inflammation seems to be elevated in depression. And the answer is that if you look at the effect of hyperthermia a week later or 4 weeks later, it has no effect on the immune system that we can see. But it has a huge effect on the inflammatory immune system immediately. So we got blood right before the treatment and right after the treatment. And the active hyperthermia, but not the placebo, produced a giant acute increase in some of the inflammatory chemicals in the body. In particular, there's one called interleukin-6 or IL-6, which is an inflammatory cytokine. And interestingly, it's been reported hundreds of times to be chronically mildly elevated in depression. If you're wandering around with increased IL-6 chronically, you're at big increased risk of heart attacks and stroke and over time dementia and maybe cancer. So we know that it's either a bad actor or it hangs out with bad actors. But in our study, what was remarkable was rather than lowering IL-6, the hyperthermia just jacked it up. And amazingly, the higher people's IL-6 went up immediately after the treatment, the more undepressed they were a week or two later. So we have this very striking and surprising immune finding suggesting that it did something to activate at least part of the inflammatory circuit. And the more it succeeded in doing that, the more intense the antidepressant response was. So we think that it's doing something to the immune system that we don't by any means understand yet, that may also be implicated in its biological mechanism.
And is there a possible link with the fact that we know that when the body is attacked by germs and we develop a fever, that thermoregulation is in play there? Do you think there's a possible link with that basic story?
There may be. So there's a complexity, which is that fever and hyperthermia are really biologically opposite to each other, with the exception that both result in an elevated body temperature. In fever, think about, as your body temperature is going up, you never feel hot. You feel like you're freezing to death. And the reason you get a fever is because you do everything you can to raise your body temperature. And the reason you're trying to raise your body temperature is because the microorganism has activated inflammatory chemicals that float up to your brain and cause the thermostat to rise, right? So instead of keeping the thermostat at 37°C, the cytokines say, we want the thermostat to be at 38.5, right? And so you feel like you're freezing to death until you get to 38.5. And then if you take an aspirin or, a non-steroidal, all of a sudden you break out into this horrible muck sweat. That's because the medication has put your thermostat back to 37, and now you're a degree too hot and you think you're burning up, right? So hyperthermia is a little bit like taking the ibuprofen. You're adding heat to a body that does not want to get hotter. So you feel very hot, you don't feel cold, and you sweat like crazy. You're trying to lose heat. So as you're getting a fever, you're trying to hold on to heat. When you're in a hypothermia situation, you're trying to lose heat. So we know that there are different processes, but there is an interesting link, which is that there was a study done in Germany in the mid-1990s where they actually took people, very small study, only 7 people. They took people that were horribly depressed and shot them up with a very strong inflammatory stimulus. So it'd be basically the same as getting a horrible flu. It's with the cell wall of these bacteria. It's a thing called endotoxin. And endotoxin, of course, causes you to get a real fever and you feel sick. It's like, So they did that to these really depressed people. And rather than making them worse, it actually worked remarkably well as a very rapid treatment. By the next morning, all 7 of them had gone essentially into remission. They felt way better. Most of them relapsed after a day or two, but a couple of them really continued to feel better for a protracted period. And the idea of fever therapy is a very old idea. Somebody, I can never pronounce his name, but a German guy won a Nobel Prize for it back in the day. They used to treat syphilis with it, and it was sometimes successful. So there may be a connection, Raj. This is one of the great questions. We don't know the degree to which the hyperthermia, the heat itself, is what's driving the change, or whether the hyperthermia in a way is a marker of underlying systems being activated, and if you could activate them without the heat, would you get the same antidepressant response? We just don't know the answer to that yet, but it's a great question.
So what's the next step in this story in terms of your research?
Yeah, so we've got 2 next steps. The first next step is to go after this inflammatory molecule, this IL-6, this interleukin-6 I was talking about. So, we know the treatment makes it go shooting up. We know that the more it shoots up, the more undepressed people get. So we want to know, well, holy moly, is there something we don't understand about this IL-6? We always think about it as being pro-depressing, but maybe if you isolate it in certain circumstances, maybe it has a secret, powerful antidepressant effect, which would have huge implications that would extend beyond hyperthermia. So the first study we want to do is to actually give people a drug that blocks this chemical. There are now FDA-approved drugs that block IL-6. They use them for autoimmune conditions. We want to give people that drug and see if it prevents the antidepressant response. If it does, then we know we've discovered something really important about IL-6. If it blocks the IL-6 but doesn't block the antidepressant response, then we'll know that IL-6 is just linked to something deeper that is having the antidepressant effect, and then we keep going. So the first study we really want to do is trying to get at the mechanism based on our findings to date. At the same time, hopefully we really want to kind of do them together. The second study is to look at the very obvious question of whether, if one treatment is good, would 2 treatments be better? Because, one of the great questions here is, wow, if we make people feel better for 4 or 5 weeks, what if we gave them another treatment 4 or 5 weeks later, Or if they got a little bit better with one treatment, would they get better with 2 treatments given, say, a week apart? Or if they got, medium better with one treatment, could we put them into remission with 2 treatments? So we've designed, and we're waiting for funding to do a dose-response relationship, where we basically do the very simple question of whether 2 treatments are better than 1. And depending on what we find in that, it's going to have a lot to do with how the hyperthermia is positioned. If we find that 2 treatments are better than 1, or that they produce a longer effect, then we have some pretty good evidence that this whole body hyperthermia may be a viable long-term treatment for some people. It takes a couple hours, but people really like it. It's safe. It could be a new part of our armamentarium. If we see that multiple treatments do not produce an increased effect, then we know that its clinical use is likely to be more limited, but you might imagine that it could still have some real interesting potential. So for instance, you might think about, inpatient psychiatric units, taking people that are very, very depressed and giving them a hyperthermia treatment, which is enjoyable and which produces a very rapid effect. Give them a hyperthermia treatment, and, then wait a day, start them on an antidepressant, and maybe instead of them having to stay in the hospital for 6 days, maybe they could stay in the hospital for 3 days. And even that would be a significant advance. So those are the next steps that we're looking at.
Well, Charles, thank you very much indeed for talking about this fascinating research. We're running out of time, but one final question, maybe a slightly mischievous question, which is going to make you run maybe screaming from the room. But I was intrigued that this equipment that you use, this very specialized equipment, exists at all in the first place. I'm assuming it must have existed for another reason, for some other purpose. And I was just trying to figure out, it's very expensive as well. I was just trying to figure out what purpose did it exist for before you got hold of it and started using it for your research.
Well, in fact, that's a very easy question to answer, Raj. So it turns out, not so much in the United States, but all over Europe, hyperthermia is widely used. It's widely used as a treatment in cancer, again, at much higher temperatures, right? So this box, I mean, if you really want to go to town, you can cook people, you can really get their body temperatures up. So the machine is used at higher temperatures for cancer, and it's used for research in cancer. There's a whole active, cancer hyperthermia research world, because there's some pretty good evidence that it does help kill cancer cells and maybe activates the immune system. And then it's also used fairly widely, although it's not been very rigorously studied for this, but it's used fairly widely in the treatment of autoimmune conditions in Europe. Interestingly, they tell me, and this has never been studied, but this is sort of the word on the street, that a condition called ankylosing spondylitis, which is somewhat related to arthritis, is especially responsive to hyperthermia. But a lot of people use it for rheumatoid arthritis. So it has hyperthermia is fairly widely used in Europe for treating a variety of disorders.
Charles, thank you very much indeed. So we've been talking to Charles Raison, who holds a special chair, and the chair is referred to as the Mary Sue and Mike Shannon Chair for Healthy Minds, Children and Families, and he's at the Human Development and Family Studies School of Human Ecology, University of Wisconsin-Madison, in Madison, Wisconsin. The title of the paper, for any of you who want to look it up, you'll be able to find at least an abstract on the web. The title of the paper is Whole Body Hyperthermia for the Treatment of Major Depressive Disorder, a Randomized Clinical Trial, and it's published in the journal JAMA Psychiatry. Charles, thank you very much indeed.
My pleasure.